South Africa has one of the highest reported rates of new TB cases in the world. Many of us will become infected with TB at some point in our lifetime, but only 1 in 10 will become sick. However, if your immune system is already weakened by certain chronic diseases, this likelihood increases dramatically. There are 2 kinds of TB. Latent TB is when you have the TB germs in your lungs, but there are no symptoms and you are not infectious. Active TB is when the disease shows itself. This is when people become sick and also infectious. Typical symptoms include fever, unexplained weight loss, drenching night sweats, chest pains, and prolonged coughing, sometimes with blood. Some people may have all these symptoms, while others may only have 1 or 2. If you have HIV or diabetes, are malnourished, smoke cigarettes, or consume large quantities of alcohol, you are at higher risk of latent TB becoming active TB. A person who has the active disease in their lungs can spread it through the air. If you're in close contact with someone who has TB, you can get it, so you must get evaluated and tested at your nearest clinic. If you have active TB, you must get treated right away. If you are at a higher risk for latent TB becoming active TB, you may be given medication to prevent that from happening. It's important to take all of your meds as prescribed for the entire duration prescribed, even if you start feeling better. If not, you can get sick again. Also, until your doctor or nurse confirms that you have been cured of TB, always cover your mouth with a tissue when you cough or sneeze. Wash your hands after coughing or sneezing. Avoid close contact with others. Avoid public transport and public spaces while you are contagious. Use a fan or open windows to keep the air around you clean and fresh. If you've been in contact with someone with TB, or if you have any of the symptoms of TB, visit your nearest clinic as soon as possible. Making your health matter. I'm Kathy Mutlahlana.